Free movie here?
Yeah. I do have a disclaimer tonight. We are recording this on Facebook Live and YouTube Live tonight. So you won't be actually, your faces won't be in it, but if you ask a question or whatever, you may be, they may hear you. Okay, is that okay with everybody? All right.
See?
All right. Okay. Well, welcome to tonight's health and wellness class. We're going to be super focused on scoliosis today. A little bit about myself. I'm a 1992 Palmer College of Chiropractic graduate. The campus in Davenport, Iowa, it's considered the fountainhead of chiropractic. It opened in 1897, and most people that started other chiropractic colleges all graduated from there. That's why they call it the fountainhead. And then in 95, I became a chiropractic neurologist. That's a specialty within chiropractic. You have to have a minimum of 400 hours to sit the board. It's a very tough exam. 80% of the people failed when I took it, and I was one of the lucky 20% that passed. And now I have, because you have to do hours every single year, and a lot of time has passed, I'm approaching, like 1,700 hours in neurology. And I was named a fellow of the Palmer College of Chiropractic in 2011 for contributions to the college. And then in 2015, I became a clear certified doctor. I had a personal experience with my 12-year-old daughter who had progressive scoliosis, and what we were doing wasn't working, and we went to the Clear Institute in St. Cloud, Minnesota, and she got good results. And then I have scoliosis, and I decided to go through the care myself, and I got good results. And we'll show my next daughter in a minute. You'll see how her curve didn't progress like mine and my daughter's did.
What's good results? What do you mean by good results?
Well, my curve had progressed up to an 82-degree curve, and it reduced down to 48 degrees when I was there, which was pretty amazing. And then it crept back up to around 60, but still 22 degrees better than it was when I first started this. So, and my daughter had gone up to a 48-degree curve, and we just redid her x-rays, and she's at 33 degrees. So she's now 23, and so in an 11, she actually, her x-rays, since we got back and I started doing the x-rays here, every x-ray we took of her is better than the one before. So, which is pretty cool. And then there's another level of clear certification where you're in intensive care, and that is for people that come from other states and countries to your office. They're there for 2 weeks. They do 2 hours twice a day. And we've had people who come as far away as China to undergo that type of care here. And then the Scoli brace, we became a Scoli brace provider. With certain curves, the care is much better with the Scoli brace. And also, when you're younger, like pre-puberty, you can actually change the shape of the bones. So when the scoliosis progresses, you actually get asymmetrical bone growth. And so the brace helps to control that, which is pretty amazing. So what do you think the USA is ranked today in overall health? There's about 200 countries in the world.
Worst.
Not that bad. We're 37th. Would you agree we should be a lot higher than that? Yeah. There's some of the reasons right after Halloween that we don't have the greatest health. What do you think we're ranked in the world in infant mortality? This is a tough one for some people. 52nd. Well, why is that? We have so much technology because birth is already something that's perfect. And if you try to improve on perfection, you can't make it better. You'll actually make it worse. And so you can have third world countries have a better infant mortality rate than we do because of just keeping it simple, right? Over 1 million mothers, daughters, fathers, sons will die from heart disease and cancer this year. Would you agree we need to make some major changes in the way we approach our health? Yes. There's 5 attitudes that prevent us from being healthy. 1, it's out of my control. 2, it's normal to get sick. 3, disease makes us sick. 4, only see the doctor when you're sick. 5, it's expensive to be healthy. These attitudes prevent us from being healthy. First attitude is my health is out of my control. You can't blame it on your parents. Only 1% of all health problems are result of genetics. So it's what we do every day that determines whether we're healthy or not. Are drugs the answer to humanity's problems? Well, the United States consumes more drugs than any other country in the world, yet we're ranked 37th. So we know drugs aren't the answer. A matter of fact, all drugs cause side effects. So if you take a drug for one condition, it will create another problem, and then you have to take a drug for that condition, and that's how people end up on so many medications. The average 65-year-old is on 8 medications a day. Prevention versus crisis. If you buy a new car, drive it as hard as you can, never change the oil, never do any maintenance, eventually that car will blow up. If it blows up in front of a new car dealership, you can get out of that car, get into a new one, and just drive off, right? But you can't do that with your body. It's the only one you get. You got to take care of it. And so you have to practice prevention. What are symptoms? Symptoms are merely the result of the body being out of balance and alerting you to a problem within. Symptoms serve as a warning that something needs to be explored and changed in one's life. Illness is a message, Dennis Jaffe, PhD. So if a fire alarm goes off, you wouldn't cut the wire to the fire alarm. You find out why it's going off. Second attitude is it's normal to get sick. Is it normal to get sick? No, it's normal to be healthy. We're going to talk about the difference between sick and healthy a little bit more. Everybody has a genetic potential. We call that the seed. And then there's the soil. That's our environment, right? There's plenty of people with great potential that never amounted to anything. And then there's other people that didn't have as much potential, but they had a great environment and they ended up being great. So it's the soil that's the most important. Third attitude, disease makes us sick. See the word disease is hyphenated there? Ease is what Hippocrates, the father of medicine, called health. And then dis-ease is when we move away from that. So we have a balanced state, and when we get out of balance, that's lost health. This is before any kind of symptoms show up. And then disease without the hyphen is the full-blown pathology like you would see under a microscope. Something is wrong. So health is harmony inside the body. Disease is lack of harmony inside the body. We spend billions of dollars a year studying disease and virtually nothing on health. So if we're studying disease all the time, what do you think we're going to get? Disease. So we need to focus on people that are doing really good and see what they're doing, and then we need to copy that. Mother Teresa was asked to speak at an anti-war rally, and she refused, and people were up in arms. Why won't you speak at an anti-war rally? And she said, well, if you have a pro-peace rally, I'll speak at that. So what you focus on, you bring about. How life begins. 2 weeks after fertilization, the primitive streak is created. This will become the central nervous system, the master system, controlling every other cell, tissue, and organ in the body. So the spinal cord is created as the baby grows, and then everything comes off of that. This is called the primary fetal curve. And when we do the kyphosis, if any patients do that, we're working on restoring that fetal curve. So when you're in utero, you have this amniotic fluid and this curve. It works like a big spring, and if the mother falls, it protects the baby. When the baby's born, you don't want to put them flat on their back because you're going to take this curve out. You want to maintain this curve. And then when you look up like this, that's putting the curve in the neck. Okay, so the baby's at 3 to 6 months, they do tummy time. Their brain is putting that curve in the neck. It's like an innate thing. You're born, you're destined to do this. If you just put a 3-month-old baby on their stomach, they start doing this. And that's when you develop the curve in your neck. So if you don't have a curve in the neck, either you had trauma to your neck before or after that 3 to 6 months, or the baby never did this. And then at 6 to 12 months, you crawl and you put the lumbar curve in. So then you have these 3 curves, and then you're ready to stand up. So a lot of times with scoliosis or learning disabilities, the mother will say, the baby went from scooting to running. Like, everybody's so excited because my baby's 7 months old and they're running around. But no, it's better to go through these maturation stages and be more solid. Okay, so we don't like the Johnny Jumper, the saucers, all those things, because they're loading up the spine. Like, you want to use the sling to put the fetal curve in at first. And then when the baby can sit up on their own, you can put them in a front back. When a baby can stand on its own, then you can get them to stand around. But you don't want to be propping them up when they're not ready for it, because that'll cause them problems. And there's also studies that show with the saucer, they can't see their feet. So there's like a spatial issue, the coordination. It's like learning how to read in Montessori. The baby's looking at the mother's lips, and they're seeing so they're learning how to read with the experience of the mother looking at her face. She's reading the words, the mouth is moving. When you're learning to walk, if you can't see your feet, it's a totally different experience than if you can see your feet. Defense against germs. There's no magic bullet, instant gratification, or miracle cure against viruses or bacteria. There is only increased internal resistance from hard work, nutrition, exercise, rest, positive mental attitude, and chiropractic care. The central nervous system controls the other 5 systems in the human body: glandular, elimination, digestive, musculoskeletal, circulatory system, and lymphatic system. So everything comes from the brain, down the spinal cord, out to all these systems to keep them healthy. Gray's Anatomy states the central nervous system controls every other cell, tissue, organ in the body. So all healing occurs from above down, inside out, out the spinal nerves. Your body's 98% new every year. So,
Are you sure? I don't
Yeah.
think mine is.
do you get your haircut still?
Yes.
Okay.
All
Is
right.
that true for bone too?
Yes. Julia, do you still get your fingernails clipped?
Sure.
Okay. So your body's pushing out new cells. The question is, are they healthier than the ones before? Even a spur on an x-ray is not the same spur that was there 3 years before. It's replacing itself. But if the stress pattern is the same, then it's going to build up and get worse and worse and worse. So the question is, are you regenerating or you're degenerating? We want you to be regenerating. Gray's Anatomy, Guidance Physiology states the autonomic nervous system is the major system controlling the mechanisms of homeostasis. Homeostasis is your body's ability to adapt to the environment. So, Shiloh, is a fever good or bad?
Bad.
Okay. If your body, let's say you go do you like oysters?
Never had one before.
You're in Florida now. Well, guess what? Cookout oyster season is upon us. The weather has to be cooler. It's R month. We're in the third R month, right? So it's prime time oyster season. When you have an oyster, you want the oyster to be a good fresh oyster, right? And it's a good source of zinc. It's one of the things that helps with COVID is zinc. Zinc is not stored in the body well, so you need to take zinc on a regular basis. So it's hard to get it from food. Zinc's a good thing. We recommend liquid zinc from Metagenics is a good source. We have a source for that on our website. So you eat an oyster, and it's a bad oyster.
That would be bad.
You start throwing up. Is that good or bad?
Bad.
No, it's good. Your body is rejecting, your body has recognized that something's wrong. This is bad food. It shouldn't be in your system. You want to get rid of it. If it just stayed in your system, that's disgusting, right? So imagine if you have a germ, bacteria, or virus in your system, and your body wants to get rid of it. You develop a fever, and the higher the fever, the quicker it kills the virus or the bacteria. So is a fever good or bad?
Good.
Good, right, correct. So that's what health is, your body reacting to what's going on. If your body's not reacting, then that's sickness. Subluxation is a bone out of place interfering with the nerve. So the bone has gone backwards into the nerve root, it's interfering with the nerve. We see the word silent degeneration there because 90% of your nerves control bodily functions, only 10 have to do with pain. So you can have a lot of degeneration without ever experiencing pain. And then you may have a sudden event, like a fall or a car accident, or even, we had some patients recently that had COVID, and just the stress of that affected their cerebellum, so their posture got worse, their spinal stability got worse, so all of a sudden all these symptoms came on. But this process had been going on for a long time, interfering with their health. They didn't feel any pain though, but it may have been affecting their health in other ways. So you see the word silent decay there. Your body is like a garden with proper raw materials and no interference. You will regenerate and be healthy. Healing takes time. So the hose is like the spinal cord, the sprinklers like the nerves, the flowers are like the organs. If you have a rock on the hose, then the organs are going to die. You take the rock off the hose, then the flowers are going to regenerate. Subluxation distorts the structure of the spine, reducing and eliminating curves, therefore altering the biomechanics of the spine. Research shows when this happens, you create a degenerative process that always goes to completion. This curve has this bridge to give it strength. And in your spine, from the side view, like we talked about with the fetus, you have these curves and your body works like a spring and makes it strong and protects it. If you don't have those right curves, then your spine is going to degenerate. Subluxation equals degeneration. This is some statistics from a famous study called the Windsor autopsies, where they did 100 cadaver studies. They found that everybody had some pinched nerves, that wherever that nerve went, the organ also showed pathology. The worse the organ, the nerve, the spine degeneration, the worse the organ degeneration. So that's why it's important to get adjusted to allow your body to regenerate and heal. Why do you go to a chiropractor? To get adjusted, correcting and preventing subluxations. Subluxations are
Bad.
They're bad. That's good. That's where the bone's out of place interfering with a nerve. But that was a good answer. This is a 52-year-old patient that came in. This is their x-ray in their first visit. They had neck pain, shoulder pain, mid-back pain, numbness and tingling down the left arm, depression, migraines, high blood pressure, anxiety, insomnia, tinnitus and acid reflux. Work had become difficult and they could no longer hike or walk due to pain. Their rate quality of life is 3 out of 10. They are on pain medication and blood pressure medication every day. And they just recently started chiropractic care. So the head's severely forward. Every inch your head's forward, it weighs another 10 pounds. So their head, instead of weighing 10 pounds, feels like it weighs 30 pounds. They have a reversal of the normal curve, so that's going to stretch the spinal cord. They have disc degeneration and bone spurs, so there's no coincidence that they have all those symptoms. This is a healthy spine, no pain or conditions. Patient works full-time, walks 2 miles every day, pain-free, rates quality of life 10 out of 10. They do not take any medications. They do take chlorella, that's a compressed algae that has all your vitamins, minerals, and protein, helps your alkalinity. They received corrective chiropractic care at age 26 and have had a monthly maintenance adjustment every month since then, and they're 55. So they're 3 years older than the previous patient, yet they have no degeneration. And the whole point of that is when we look at the x-ray, the degeneration is not caused by your age. It's caused by your alignment. If a car is out of alignment, the tires wear unevenly. If the car is in alignment, they don't wear unevenly. I bought a new set of tires one time and went on a road trip. Within a couple 100 miles, I had a flat tire. They had not they hadn't balanced the tire right. So it wore out really quickly. So this patient, the head's half as far forward. They have the proper curve in the neck. good disc spacing, no bone spurs. So wherever you're at, you want to work toward the healthy spine. This patient came in with severe migraines. She was on migraine medication, missing school. She was a patient at Mayo. She had seen the best neurologist in the area, and she was just a migraine patient and on migraine medication. And they brought her, so even though she was on the migraine medication, she still had migraines. She was missing school. That's all they could do for her. She came in to see us, and as soon as I saw this x-ray, I thought I could help her because the head was severely forward. These two should be parallel, and they were compressed back there. She had a complete reversal of the curve in the neck, so that stretch in the spinal cord. That's what was causing the migraines. She went through 2 months of corrective care in the office. These are now parallel. The head's not as far forward. She has a better curve in the neck, relaxing the spinal cord. No more migraines. She was able to come off the medication, return to school full time. If she would have never came in the office, she would have just been known as the migraine patient. And the migraine medication has a lot of side effects. So if you start on it when you're 12 years old, it's going to cause side effects, right? You're going to have other things go on. This is my now 16-year-old, and when she first came in, got x-rayed, when we realized she had a scoliosis, she had a 22-degree curve when she was 9 years old. And then we were working on it through adjusting and exercise, and it went down to 16, and then it went down to 10 degrees. Less than 10 degrees, you no longer have scoliosis. Now, the other daughter, the curve progressed to 48. Mine, when I was 18 years old, was a 68-degree curve. In chiropractic school, when they x-rayed me, I was known as the asymptomatic 68-degree curve. That's how they described me. So the interesting thing is when she had the 22-degree curve, her upper neck was way out of alignment. Can you see that? And then when this got better, she had the 16-degree curve, and then when it got really good, it went down to 10 degrees. So the upper neck is the control center. So if you have birth trauma to your upper neck, fall on the head as a kid, any kind of misalignment in your upper neck can contribute to scoliosis. And they've done studies on this. Not a lot's been published, but at University of Washington, St. Louis, where they have one of the premier scoliosis centers in the United States, they've studied the occiput C1, C2 in the relation to scoliosis. They know that if you have ligament damage there, you're more likely to have scoliosis. This is an adult that went through our corrective care. She went from a 24-degree over 12 to 13 over 9. This is a patient that got into an auto accident when she was about 12, severely got out of alignment. 3 days later, when her leg length got better, we retook her x-ray and everything was balanced out. So when something happens right away and you're a child, it's much easier to correct. So prevention is very important. This is somebody also about 10 years old, and when this is the x-ray from here, so you should have a forward arc, which is this one, but he had a complete reversal of the curve, and with the gaming and phones and stuff like that, this is very common. And we're actually going to see a lot more neurogenic diseases, right? As time goes on, we're supposed to get healthier. But with things like that, when I was in chiropractic school, we would never see an x-ray like this in a 10-year-old. It's because of phones and gaming. Think about it. A 10-year-old 40 years ago, they never sat down. They came home from school, the mother never saw them. It started getting dark, they came home because they knew it was time to eat. You know, and then they went to bed. That was how it worked. Now, 2 o'clock in the morning, they're like gaming still, right? So it's screwing up all kinds of things. So he went through 2 months of corrective care, had a really nice correction, so we really made a big change in him. You can see how it was affecting his colon. The colon was really blocked here. Even after the correction, it still was not working as good as it should. I just did a podcast for Clear today, and one of the things we were talking about is the relationship with digestion and lumbar scoliosis. This patient is the daughter of a medical doctor up in South Carolina who came down for corrective care. This is her 6-month post x-ray, and she actually got to the point where she no longer had scoliosis.
How old was she?
Like 14 probably. This is a patient from Palm Coast, also had resolution in the scoliosis. So in the office, we use these principles for both scoliosis and non-scoliosis patients. We call it mix, fix, set. So mix is a warming up of your spine to get it more pliable to correct back to normal. Fix is the specific adjustment. And then set are exercises to get the brain to hold everything in alignment. So the mix is the first part of the visit. That is everything we see here, okay? So it's our warm-up wobble chair exercises, cervical repeat traction, the Eckert table. If you're a scoliosis patient, you're placed in a mirror image of your curve, so the curve actually disappears while you're doing this traction. Cervical repeat traction is helping to bring the curve in the neck, head back over the shoulders. Core stem is helping to balance the muscles out. Most scoliosis patients, on the inside of the curve, the muscles atrophied. On the outside, it is overworked, and there's a lot of lactic acid. So most people have a left lumbar curve, and so right in here, they just have a huge bunch of muscles that are just like all locked up right here. And so the core stem helps to balance that out. Mechanical drop is helping with rib deformation and breathing, especially if you have a thoracic curve. When I do this one, I feel like, anybody ever had pure oxygen, like a nasal cannulus? You always feel like a burning sensation when you're breathing pure oxygen. That's the feeling I get when I do this. It's just my ribs are ventilating better, so I'm breathing better. It's not that I necessarily think I'm breathing bad when I go on it, but when I come back, when I come off of it, I can just feel I'm breathing better. The specific adjustment, kyphosis restoration. So we talked about the fetal curve in the baby. We want to preserve that fetal curve. There's a lot of research that shows scoliosis patients, when you put your hand in between their shoulder blades, they're very flat there. Some people actually have a forward curve there. So you're supposed to have a backward curve in the mid-back. When I was at the Clear Institute, as part of my course, we had a patient from Germany with an 80-degree curve. She had like a 40-degree lordotic thoracic spine. So between her shoulder blades was just like a hole right there. So you want to restore that thoracic curve on an adolescent scoliosis, for sure. And scoliosis traction chair. This chair, you're in placed in a mirror image of your curve. The chair vibrates at a frequency to get the brain to hold everything in alignment. Most exercise makes scoliosis worse. So if you're doing a pull-up and you have a severe scoliosis, it's going to kind of go like that. If you do a sit-up, you can actually see the umbilical cord going like this. So when you exercise, you're strengthening the pathways that are already overdeveloped, not the ones that are underdeveloped. And this was a breakthrough. It helps to develop the underdeveloped ones. And so does the spinal weighting. So this is part of the set, getting the brain to hold everything in alignment. We have you do that for 30 minutes and watch Netflix. And then the spinal weighting is getting the brain to hold everything in place, but it's a little more active. So the muscles that hold your spine in alignment are subconscious. So this is like an indirect exercise. So we have people doing a word search, so they're not thinking about exercising when they're doing this, they're just doing the word search. But their brain is actually balancing, and when they do that balancing, it's actually straightening their spine out. So we do an x-ray while they're doing this to make sure it's doing what it's supposed to be doing. And we also do an x-ray of this one to make sure it's doing what it's supposed to be doing. And then we use that to train the body into that better position. Scoli brace is the future of scoliosis bracing. It's an overcorrective or supercorrective brace. Most medical bracing is like a tube, and it's just holding your spine in position, and they're hoping it doesn't get worse. This is an overcorrective or supercorrective brace. So if your scoliosis has you here, the brace is putting you here. It's a mirror image of your bad curve, and it can actually train your brain to hold everything in alignment, which is more muscular in an adult. In a child, before puberty, you're actually reshaping the shape of the bone. because the bones are going through this kind of bone growth. And we have a structural scanner, and it creates a hologram of the body, and we send that to Australia with your posture pictures and x-rays, and they make the overcorrective brace. It velcros in the front so you can put it on yourself. There's air holes for ventilation. You can see this is a right thoracic curve. So the person actually has a left thoracic curve while they're wearing it, and a right lumbar, just the opposite of what their x-ray looked like. So this patient, you can see they had this left translation in the brace. They're going to the right. Out of the brace 12 months later, you can see the correction. They went from 33 degrees to 11 to 6 degrees over 22 months. So they were caught at the time of development, so they got a really good correction. And Julia, that's the plane. This is an adult wearing the scoliosis brace, a full brace. So they have a 64-degree curve, so their curve is very similar to mine. When they're wearing the brace, they have a 39-degree curve. So it's not that it's going to totally get rid of the curve, but while they're wearing it, it reduces the curve down. They feel a lot better, and it's helping to prevent progression and actually make some reduction, but they're never not going to have a curve. Meaning in the brace, they only go down to 39 degrees, not to 0. If they were 10 years old, it would be different. They might actually reverse the curve in the brace, but it still benefits the adult. So because of the nature of the scoliosis, adults can get a lot of degeneration and some postural deformation. So they may get off center, either from the front or from the side. The brace helps to hold them in position, and they found that that really helps them be able to do more things. Wash dishes, cook, all these things. And the adult brace, usually it's in the lumbar spine, and this is a lumbar brace. If the curves also up here, then they need more of a full brace. This one's a lumbar one. Waiting is dangerous. We want to avoid surgery because there's infections from surgery. You could have severe blood loss, many different side effects from having surgery. I did another blog recently and podcast about we see patients that have already had surgery, and many times when you read the research with scoliosis surgery, they'll say it's not a question of will the hardware fail, it's will you live long enough for it to fail. So if you have the surgery when you're 12 years old and you live to be 80, eventually something's going to break in that hardware. And then they have to decide what to do. Are we going to pull the hardware out? Are we going to try to fix it? And these surgeries can be complicated at that point. So that's one of the reasons not to have surgery. Also, if you get into like a car accident and those rods are in there, the rods can break. And then again, they have to decide what to do. So these are all things to consider when you're thinking about surgery. How do we get subluxations? Well, first of all, what is a subluxation?
Bad.
It's a bone out of place interfering with the nerve. But how do they happen? Overwhelming stress, trauma, and toxins. These are things that pull our spine out of alignment. Think about it like an electric panel. You have the hairdryer going, the dishwasher's going, you put the blender on, and the power goes out, right? So when your spine's in alignment, when it gets overstressed, it can pull out of alignment. Now, toxins, if we're taking medication and that can toxify the liver and the kidney. There was a guy, when Reagan was president, there was another guy named Reagan, I think he was like the Secretary of the Treasury or some position. There's a famous article about him, and research was done because he was on a medication and he was told not to drink alcohol. He had one drink and went into kidney failure and had to have his kidney taken out, went on dialysis and needed a kidney replacement. And so he's like a famous case because it was the news kind of followed him. But there's reflexes in the body. There's somatovisceral reflexes, meaning when the bones get out of place, they interfere with the nerves, they interfere with the organs. That's somatovisceral. Then there's visceral somatic reflexes. When the organ gets toxic, it'll pull the spine out of alignment. So when people wondering, people need more chiropractic care today than they did 100 years ago. Because 100 years ago, people were living on a farm, they were out hunting, raising their own food, there was no pesticides, no hormones. So one of the things that they think could make making scoliosis worse is just the food supply. We're subjected to a lot more hormones than we were 100 years ago. The original subluxation. Birth is one of the most violent things that we go through, and if it's more violent than it needs to be, it could mess the upper neck up, okay? So this is a picture taken from a video of the Department of Navy. They're teaching doctors how to deliver babies. Does anybody notice anything here? They're pulling the baby's head, which can easily misalignment the neck. So there's a saying, when the apple's ripe, it falls from the tree. So when you're in natural childbirth, you're waiting for the baby to come out when it's ready. But you don't need to force it along. And if they really need to force it, they use forceps, which can really mess up the baby's neck. The cause of all disease is your body's inability to regenerate. Balance equals health. When you're in balance physically, chemically, and emotionally, you will be healthy. Fourth attitude, only go to the doctor when you're sick, and you better have insurance. Better to go to the doctor when you're healthy, and then you won't need insurance. Fifth attitude, it costs money to stay healthy. True, however, it costs a lot more money to be sick. 50% of all bankruptcies are caused by medical bills. Prevention makes more sense. Take care of your incredible body. So if we're out of work and we have accumulating medical bills, that's the worst case scenario. When we make decisions in life, it should motivate us to avoid that situation. So when we're thinking about, do I want McDonald's or am I going to have a green smoothie, right? Am I going to remember to exercise? Did you do your exercises today? Are we going to smile? Okay. All these things help prevent things from getting out of control. In the state of Florida, we have a very unusual auto insurance. It's a no-fault state. Most states, if somebody hits you, their insurance pays for everything. In Florida, everything goes to your insurance first. So it's important for everybody to know that. And you have 14 days to get to the doctor to get an exam, and the doctor has got to state that it's an emergency medical condition. If they don't do that, you're not covered with your PIP auto insurance, which the state makes everybody carry, all right? Now, you can have some unusual symptoms from the auto accident. Nausea, dizziness, jaw trouble. Just had a patient tell me they had some ringing in the ears prior to the accident, but now it's like double, and it's just not going away. They lay there in bed at night, their ears are ringing, it doesn't stop. It's been like that since they had the auto accident. Changes in vision, lightheadedness. So let's say a patient goes to work and they're just not concentrating. They don't get as much done at work after the accident, but that's the only symptom they have. 2 weeks go by, they call the neurologist, they're like, I think this is related to the accident. Guess what? It's not covered from your PIP insurance, and nothing's going to change it because this is the law, okay? So if you get into an accident, make sure you get checked within 14 days. You're going to tell them, make sure you put in the notes, it's a emergency medical condition. 3 phases of chiropractic care. The first phase is relief care. We want you to feel better. If you're not feeling better, you're not going to be happy. Second phase is corrective care. That can be the 2-week intensive care where you're coming in twice a day or 2 to 3 times a week care, working on correcting your spine as close to normal as possible. And then the last one is preventative care. That's different from everybody depending what your stress level is, usually once a week to once a month care. 90% of the nerves control your bodily functions, only 10% has to do with pain. So you don't know whether you're in alignment or not. So when we check your posture, check your leg length, that's telling us whether you're in alignment or not whether you're hurting that day. The neck bone brings the head back over the shoulders and the curve in the neck. So most people are sleeping like this, makes the head go forward, takes the curve out of their neck, makes everything worse. Headaches, scoliosis, neck pain, numbness in the hands, even lower back pain. So the neck bone helps you to lay on your back and your head touches the bed. This puts the curve in the neck. These are prism glasses, so you're looking forward, but you're seeing this way. So it helps to stop text neck.
So are you able to wear those glasses with?
I put them over my
You
glasses.
put them over your glasses?
Yeah. You can try it. We have if you do anything laying down over here, you can try them while you're here. And then we have a pair over there to try. But yeah, some people it really makes a difference. Because if you're sitting there for hours like this, it's hard to get a correction.
So what about your side sleepers? I can't sleep on my back.
So we recommend that you do this while you're icing, after you do your exercise for like 20 minutes. When you first go to sleep, start off doing this first. You may be able to train yourself into sleeping like this. And then we have a side sleeping pillow, which keeps you in alignment this way, so you're not doing this. And then you want to have a pillow between your knees. So if you're a side sleeper, pillow between your knees bent, and then the pillow holding you in alignment this way, okay? So you're not, creating all kind of weird things. An ounce of prevention is worth a pound of cure, Benjamin Franklin. You can see the baby's holding the head up, that's the tummy time that we talked about. So he's developing that curve in the neck. The mother's happy. So this baby came in, when he was born, he had trauma to his upper neck, he had torticollis. The baby's head was stuck like this, and they were gonna do surgery. They were gonna cut here to balance the muscles, and the mother chose to bring him in here instead, and you can see she was pretty happy. He did really good after a few weeks of care. Prevention starts early. This mother has had 6 babies, and all born at home, 100% natural. And after each one was born, first she was a patient while she was pregnant, but then when the babies were born, she immediately got them checked. You can see me checking this little guy right after he was born. So, ounce of prevention is worth a pound of cure. Science-based nutrition is some special testing that we do in our office where we look at blood, urine, and hair analysis to determine toxicity and vitamin mineral deficiency. So if you're interested in that, let us know. We do a health history, all your vital signs, health problems that you may be having, medications that you're taking, and then we determine from the blood work, urine, and hair analysis what conditions you actually have based on those things, and it'll find metal toxicity, similar things that a normal GP would do, but it's more of an extensive panel that has all your vitamins and minerals. It's very helpful, and then we give you a specific formula based on what the findings are, and then we may recheck a few months later to make sure everything's looking better. When you find that we've helped you out, if you let other people know, we'd appreciate it. That's how most people find out about us. Anybody have any questions at all?
I have a question. With scoliosis, if like Shiloh were having problems breathing, like exercising and kind of being short of breath, and then having some gastrointestinal issues, could that be contributed from scoliosis?
Yes, and we see those things get better quite often. Yep.
So as she gets straightened and
And I just did a podcast this morning for Clear, and we were talking about the different mechanisms of that. So your very upper neck, which is commonly out of place in scoliosis patients, there's a nerve that comes out of the area of occiput C1, C2 called the vagus nerve. It's the wanderer, and it comes out here and controls all your digestive organs. Then you also have the ribs. So if you're out of alignment and the ribs are not moving right, mechanically you can't take a big breath, right? But also in the ribs is your sympathetic nervous system, and that's your fight or flight mechanism. So if that gets confused, you can have the opposite thing happening when it's supposed to. Meaning you exercise, your lungs are supposed to dilate, right? But if you're out of alignment, they may constrict. So there's confusion there. You may be tired during the day, but you can't sleep at night. With this, that's where my big curve is. And when I was in middle school, I would have constipation, itchy skin, all kind of different things like that. and I'm pretty sure it was coming from the
Mhm.
scoliosis developing.
Mhm.
So a lot of times those things will improve. It's important to know that as a chiropractor, our job is to focus on your alignment and the focus of the spine. That allows the nervous system to work better. What's going to happen with a better functioning nervous system, we never know, but many times conditions get better. Any other questions? All right,
That was very informative, thank you.
Yeah, it was.
glad you guys could make it, thank you. Sky was very quiet. All right, thank you.